Good morning, everyone. My name is Spring Yang, and I'm from Shanghai High School International Division. It is my honor today to present my research, which explores how digital technology or teledentistry can help us solve a profound inequality in global healthcare, the crisis of access to dental services. The foundation of this problem is a stark geographic imbalance. According to the World Health Organization, nearly 70% of all dentists are concentrated in the Europe and the United States. While yet these regions are home to only about a quarter of the world's population. This concentration creates dramatic shortages elsewhere. In many parts of Africa and Asia, the ratio can be as high as one dentist for every 40 or 50,000 people. To put that in perspective, a single dentist would be responsible for a population that is the size of a small city. This means that for billions of people, routine dental care is a luxury, and painful conditions can go untreated for years. This is the global challenge that my research addresses. In response to this challenge, the field of teledentistry has emerged. Teledentistry can be defined as the integration of telecommunications technology into oral healthcare. It uses tools like video conferencing, digital imaging, and secure data platforms to facilitate remote diagnosis, consultation, and even education. While the concept has existed for relatively a long time, its importance was enhanced during the COVID-19 pandemic. When in-person visits became risky or impossible, the use of teledentistry surged by 400%, proving its practical value in a crisis and demonstrating its potential for long-term usage. For teledentistry to work effectively, it relies on three core technological pillars. The first one is about high-quality imaging. This is the eyes of the remote dentist. Today, intraoral scanners and modern smartphone cameras can capture images of teeth and gums with a clarity that is, for many diagnostic purposes, comparable to a clinical examination. Studies have confirmed their accuracy in spotting early signs of cavities and other common conditions. The second pillar is about secure data systems. Transmitting sensitive patient information requires robust encryption and privacy safeguards. This is non-negotiable, as weaknesses in current dental record systems highlight the critical need for security in this digital transition. The third pillar is about artificial intelligence. AI algorithms, particularly convolutional neural networks, are now being trained to analyze dental images. They can assist dentists by identifying potential problems such as tooth decay and sometimes catching subtle details that might be missed by the human eye. Together, these three elements create a foundation for reliable remote care. Let's examine how this foundation supports real-world applications. The most direct application is in extending care to rural and underserved communities. The model is collaborative. A community health worker trained to use a smartphone or a portable scanner captures images of a patient's mouth in a remote village. These images are then transmitted to a qualified dentist in an urban center using a store and forward method, which is especially useful in areas with unreliable internet. Research such as the study of Steinmeier and colleagues has validated this approach. They found that diagnoses made from intraoral scans showed a 78 to 95% agreement with traditional in-person exams for conditions like cavities and restorations. For the patient, this means receiving an accurate diagnosis and a treatment plan without enduring the cost and the time of a long journey. Patient satisfaction in these scenarios is consistently high, often exceeding 90%. Beyond initial diagnosis, teledentistry is revolutionizing what happens after a procedure and in preventive care at home. In post-operative care, mobile applications like Exodont are being used. These apps provide patients with automated reminders for their pain medication and antibiotics, and they offer clear, step-by-step instructions for wound care. Field trials have shown that this digital guidance significantly improves patient adherence to instructions and can reduce the number of necessary in-person follow-up visits by about 15%. Simultaneously, for preventive care, new AI-powered apps are enabling a form of self-monitoring. For instance, elderly or homebound patients can take oral selfies. The app then analyzes these images for early signs of plaque buildup or gingivitis, providing immediate feedback and personalized oral hygiene instructions. This creates a supportive, hybrid model of care that empowers patients between their clinical visits. The reach of teledentistry also extends to fostering global collaboration and enhancing education. For complex dental cases such as implant planning or oral pathology, general practitioners can now easily consult with international specialists. With the advent of 5G network, these consultations can happen in real time, supporting the seamless transfer of high-resolution X-rays and live video. Studies note that such systems can reduce unnecessary patient referrals to specialists by 30%, making healthcare more efficient. In education, virtual reality is creating transformative learning opportunities. A randomized trial with dental students demonstrated that those who practice postures like tooth arrangement in a VR environment outperformed their peers who received only traditional instructions. This technology provides a safe, repeatable, and controlled space for students to develop their skills. So, what is the overall assessment? The evidence is promising. From an economic perspective, teledentistry shows significant cost saving potential, primarily by reducing indirect expenses for patients such as travel and the loss of work time. In terms of patient reception, satisfaction is notably high, ranging from 63 to 78% in reported studies, driven by convenience and prompt services. However, we must also be clear about the challenges. Diagnostic accuracy can drop for very subtle lesions. Older adults often face a steeper learning curve with the technology, and furthermore, significant systematic barriers remain, including inconsistent internet coverage in rural areas, high initial costs for advanced equipment, and a critical lack of clear insurance reimbursement policies for virtual consultations. In conclusion, my research synthesizes a compelling body of evidence that teledentistry is no longer a futuristic concept, but a practical and effective tool for demonstrating oral healthcare. It has proven its worth in remote diagnosis, post-operative monitoring, and specialist collaboration, all while achieving high levels of patient satisfaction. For teledentistry to mature and scale effectively, future efforts must be directed in several key areas. We need stronger digital infrastructure, particularly reliable broadband in underserved regions. Governments and insurers must work together to create clear regulations and consistent reimbursement models. Finally, investment in training for both dental professionals and the public is essential to build trust and competence. By addressing these challenges, we can create a technology to make quality oral healthcare an accessible reality for all. Thank you for listening and thank you for your time. Thank you.